Boughey, and Ellysse did her practicum with Montana Family Planning. And her site mentor is Miriam Naaman Sessions, who is a director of public health research with ASTO. And the name of Elysse's presentation is Montana Sexual and Reproductive Needs Assessment. So take it away, Ellysse.
Thanks, Lee. Again, hi, everybody. I'm Ellysse Boughey, and for my APE, I did an assessment on sexual and reproductive health in Montana. So let me advance my slides. So my site organization was Montana Family Planning, or MFP, and they are the administrators of Title 10 in the state. And Title 10 is a federal program that offers comprehensive sexual and reproductive health services. So things like STI testing, offering birth control, or cervical cancer screening, other preventative cancer screenings to folks, mostly prioritizing those of low income and those that are uninsured. And so MFP identified a need to have this needs assessment in light of recent federal and state policy changes that have changed the Title 10 landscape in the state. So with the help of Miriam Naaman Sessions, who works for ASTO, but previously was a leader in maternal and child health epidemiology in the state for many, many years, and is familiar with the issues surrounding this topic, the data methodology, we worked together on this project. So for my APE, I collected secondary data from state and national data sources like CDC Wonder, the Vital Stats surveillance system, and the Pregnancy Risk Assessment Monitoring System. Analyze that data if it wasn't already analyzed by the data stewards, and visualize that data in a Tableau dashboard. And so this project did go through the UM's IRB process, and that board did deem this project as not human subjects research. So my first product is the Tableau dashboard, and I'm going to hop out of my slides here to give you a preview. So Tableau, if you haven't worked in it before, it's a very powerful data visualization software. And so we used it to visualize these 6 different focused areas for sexual and reproductive health. And so this page that I'm showing you here is our geographic areas of focus, and that's where all of the county level data lives in map form. We also have data categorized in a pregnancy intention section, infertility, infant health, sexually transmitted infections, and adolescent health. And I don't have enough time, unfortunately, to run through the entire dashboard. So I'm just going to give you a little glimpse on this map that's shown here. And so with the help of Miriam, we created these county risk scores. So using various county level data for reproductive health risk measures, we calculated the Z-scores to determine which counties are considered high risk. So where can we devote some support for sexual and reproductive health services in the state? And so looking at this map, the lighter colored counties represent the areas of lower risk. And as that color darkens, it goes into a more higher risk. So the dark blue indicates areas of higher risk, meaning there's a greater need for sexual and reproductive health support. So when you hover over a county, that risk score category pops up. There's also a persons in need estimate, which is from the US Census Bureau's American Community Survey. They have population estimates for youth and women of reproductive age living below poverty. And that persons in need estimate is also available for American Indian reservations. And the other symbol that you see on this map, that's MFP's logo, and that represents the different Title 10 sites serving the state. So just kind of taking a step back and looking at some of these quick spatial patterns, you can kind of see some of those counties with higher risk scores tend to overlap American Indian reservations. So I'm going to hop back into the slides. Okay, my second product included 2 fact sheets. So the one shown here is a statewide overview on the key findings for each of the focus areas that I just discussed. There was also a county template that was created that's not pictured here, so MFP can create county specific fact sheets from the data of the needs assessment. So I'm going to run through some of the key findings for each of those focus areas. So number 1, about 1 in 3 counties were identified as high risk. Number 2, overall the number of women seeking pregnancy increased. However, among women under 25 or identifying as American Indian, that rate was lower than the general population. Number 3, 1 in 5 women experience infertility in Montana, and a key reason why adults, both men and women who experienced infertility, did not seek treatment was due to cost. Number 4, infant mortality rates were nearly 2 to 3 times higher among American Indian infants than the total population. And number 5, although not the most commonly STI in Montana, the rate of new syphilis cases increased 6 times in the past few years. And lastly, on average, over half of sexually active high school students reported using a condom. Okay. So here are the competencies that apply to this project through the MPH generalist track. And just in interest of time, I'm going to let you quickly read through those. I did want to also discuss some of the lessons learned and challenges that I experienced in this APE. So time constraints. This project did take about a year, and I felt like I could have used more time. I always feel that way with many different projects, but just balancing other classes, full-time job, and just changes in my personal life, I definitely had to tap into some really strong time management skills. Number 2, learning new software. This was the first time I've ever built anything in Tableau, and so there's always that learning curve with learning new applications, but I'm very glad that I did have the opportunity to learn Tableau through this APE because I'm already using it in my professional work, which is great. And it's a really powerful dashboard building software. Being selective of data points, there are so many rich data out there that cover sexual and reproductive health in Montana. And so I wasn't able to include everything in the dashboard because you want to be mindful on the user experience and also just not trying to slow down the performance of the dashboard. So trying to figure out how to paint a comprehensive picture on these issues, but also being selective of what data to include was definitely a challenge. And then lastly, data interpretation. So figuring out a way to communicate the data to folks who normally don't use the terminology that data stewards use or the terminology that's used in the survey questionnaires that's pulling, that the data is pulling from is always a challenge in every public health project for me. So that's important because you want to make sure folks can use that information to make data-driven decisions. So another piece to this practicum was the community service activities. So this semester, I volunteered with the Lewis and Clark County Conservation District, and myself and other volunteers, we harvested willows. And so the picture on the left here, there's a railroad and then there's a creek with a bunch of vegetation, and that's where the willows were harvested. And they were dormant during the time that we collected them, and they were then relocated and replanted on a shoreline in Lake Helena because they're really great at preventing erosion. So that wraps up my presentation. I just want to give a big shout out to Montana Family Planning. I really am grateful for the opportunity to work on such an important project, and everybody on the team was always so supportive. And I also want to thank Miriam for her endless guidance and wisdom throughout this entire project. And I want to thank you all for listening. So that is all from me.
Thanks, Ellysse. Nice job. Wonderful. So our next presenter is going to be Jen.